Today, we're talking about one of the most important ways that public health departments can help slow the spread of COVID-19, contact tracing. My name is Este Geraghty, and I'm the Chief Medical Officer at Esri. And I'm joined today by Adam Anderson, who is the Informatics, Epidemiology, and Health Planning Manager for Tri-County Health Department in Colorado. Thanks for joining me today, Adam.
Yeah, thanks for having me.
Oh, it's a pleasure to have you here. And I want to introduce this topic so everybody kind of gets a sense of what's going on. I want to note for everybody, and you may already know this given all of the publicity, that contact tracing is a method that has been used for decades by health departments, again, to slow or stop the spread of infectious diseases. It has been used for containing measles outbreaks, hepatitis epidemics, and HIV transmission. According to the CDC, it works by letting people know when they may have been exposed to a disease, COVID-19 in this case, and helps them get tested and monitor their symptoms. And it asks those that are already infected to self-isolate. And those that were close contacts to that infected person, they're asked to self-quarantine. Now, before COVID-19, contact tracing was normally done with paper-based forms, but given the global nature of COVID-19 and the large number of infections, the need to become more modern and efficient is paramount. So today, we're going to dive into how Tri-County Health Department went fully modern with GIS technology. So Adam, welcome again, and thank you for taking the time to talk about contact tracing with me. I know you said in the beginning of right before this call started, how busy you are, so I really do appreciate the time. And I wonder if you can start us off by giving us a little context and describing the area that Tri-County Health Department serves and what you saw early on during this pandemic.
Sure. So Tri-County Health Department is in Colorado, and we're in the Denver metro area, which includes Boulder, Denver, and the city of Aurora. And our health department we're responsible for 3 of the 7 metro area counties, which is about half the metro area population for Denver. We have about 26 municipalities within our jurisdiction. We have 14 school districts. Our geographic spread is pretty large, where we cover very urban areas in the metro area. We have rural agricultural areas on our eastern borders, and we have suburban within all 3 of our counties. And so we have very diverse demographics, where we have some of the wealthiest neighborhoods and census tracts within Colorado, and some of the the poorest census tracts within Colorado as well. We have some of the most ethnically diverse populations within Colorado as well within our jurisdiction. So we have the challenges of dealing with sort of all of those different types of communities. And then so our offices, we have 11 offices that span those 3 counties with about a staff of around 450 people. We have a very small data team. When we started out doing COVID work, our data team consisted of roughly 2.5 people. Now we're at about 4.5 people, but it was primarily the 2 of us that really kind of built out our system. And we have roughly 250 case investigators and contact tracers currently working, and I think we're actually bringing on 25 more in the next week to help with our most recent wave of infections. So to your question about what we saw early on in the pandemic in our jurisdiction, within Colorado, just generally, we actually were seeing a lot of cases coming in. I believe it was from Australia to our ski areas. And so I think that was what was in the news primarily right off the bat. Within Tri-County, we started seeing our first cases in early March, and it was, we were tracing that back to a lot of just travel, and then seeing it spread from there. We saw our first peak from those initial cases in March around May, and then we saw some declines, and then we saw a second sort of peak happen in July, around the end of July. And then now we're in the middle of sort of a third peak that's actually been greater than all the other ones that we've seen in terms of infection rates.
Wow. So I'm hearing that your modestly sized department that has been gearing up, and you have a big population, a large area of people to serve, and that you're a destination, and that destination had some consequences in terms of what you were starting to see in the early phases of the pandemic. And I'm wondering how, experience has been gained, of course, over the time of this crisis, but how did Tri-County Health initially respond to the pandemic?
So we have a disease surveillance team that has been used to dealing with a lot of the common reportable diseases that most local public health departments deal with. We've been in the news for measles, for plague, for mumps, Hep A, and they took the approach that they normally take with those sort of reportable diseases, where they generally work in spreadsheets, but it's very a very kind of hands-on, interactive case investigation and contact tracing. Our emergency response group was immediately activated, who took over the management and the coordination of the response within the agency, just in terms of overseeing those disease surveillance teams, and then bringing in the resources to kind of deal with how the COVID pandemic was progressing. And then on the data side, what we initially did in terms of the response, because at that point the questions were primarily around just enumerating the cases. I think a common phrase was flattening the curve during that initial period. And so we began by developing metrics and dashboards from those spreadsheets in which they were doing the work. We were quickly overwhelmed with the data work in that process, just in terms of getting the data into GIS, doing the data cleaning, managing all of that, and then managing the dashboards as well.
Yeah, I can imagine. I mean, there was so much ramp up across the country and the world, and that's always the first step, right, is dealing with the massive need and amounts of data. And I know that you guys went to GIS really early on, but I think I heard you say that specific to contact tracing, you kind of started with more of I don't know if it was a paper-based or a spreadsheet-based approach. How did that work for contact tracing specifically?
Yeah, so again, this is done primarily through spreadsheets in the past, and that's how they, given their workflow, how they moved forward with COVID. And so again, the case investigation part was done through spreadsheets, and so contact tracing was pretty limited, just in terms of being able to adapt that workflow from enumerating the cases and their contacts to then being able to do the contact tracing. So it was, again, just done in spreadsheets, and it was very limited in terms of our ability to do full contact tracing after we started getting a certain level of cases, just because, again, what we were used to were things more like measles, mumps, where we have a disease that's fairly quickly contained within a short period of time. And so the contact tracing the scope of it is constrained by the fact that the disease is contained very quickly, just through all of our traditional mechanisms. But with COVID, obviously, it just across the nation, in every city, it grew very rapidly. And so the ability to do that contact tracing through spreadsheets was just became very constrained very quickly.
Yeah, well, I can definitely understand that, but some people might say it's a little bit risky to do something new and move to a new system during a crisis. So why did you think that GIS could help with contact tracing, and what did the health department end up doing with the technology?
So the way that we approached it and presented it to our department was that there were kind of three main areas where we felt that GIS could really, and that the GIS solution that we have could really benefit, which was around just the basic data collection tools and streamlining the analytic process, and then the data dissemination portion in terms of both dashboarding for public data and then data sharing to our partners. And so the data collection tools were pretty straightforward in terms of just, I think that's always the easy part, is collecting the data. The portion of that we felt that we could really use several of our GIS tools was collecting it in a way that brought that location data in immediately during the collection process, where it wasn't, I guess, an additional task that was just sort of added on. So this is just inherent in the way that the data was collected. But then also there were tools within the current setup that allowed us to just facilitate the workflow, which is always, I think, a very complex part, especially when you're used to having a team of, say, 5 or 6 people doing disease investigation that then expands to 250, 300. And then also streamlining the analytic process, just where when the data is collected, that it immediately flows into the analytics that are already kind of predetermined, that we're able to create an automated process for, and then having that flow directly into the data dissemination pieces of the dashboards and the data sharing. So that was how we presented it in terms of the benefits of using a GIS for this particular problem.
You know, you said actually a lot of interesting things there. One that I kind of keyed onto, and you'll probably agree this was natural for me to key onto, is that the idea of you guys collecting location more easily, because the traditional contact tracing approach doesn't really focus on location. It asks some more broad location-based questions, but it's not a true part of the process. And yet Tri-County's approach is kind of explicitly geographic. You're using geographic software to do it. So why did you think that geography was going to be so important for contact tracing? And then tagging on to that, what have been the results of applying location-based contact tracing as an approach, which you probably know, Adam, we sort of dubbed a new term. We're calling it community contact tracing when you analyze it with that location component.
Yeah, so to the first portion of your question, just why is geography important for contact tracing? And right off of the bat for us, it was one of the most important parts was just our ability to report out based on the many geographic areas that we have. So our jurisdiction consists of 3 counties, 26 municipalities, 80 some odd neighborhoods, 14 school districts. And so it's really important that in terms of communicating with the elected officials, with the staff in those jurisdictions, with the public in those jurisdictions, that we're able to enumerate those cases and contacts by those different geographic areas. And so that's sort of the first portion of it, delivering that data to them within those geographic areas as well, because our state's variance metrics in terms of what stage different counties are at requires it to just be separated in that way. But then beyond just those kind of technical portions of reporting out data, I guess to your question about how the results of that location-based contact tracing have been fully utilized, is that when we're able to sort of at the beginning quantify those cases and contacts by those geographic areas, we can better understand the methods of transmission based on those geographies, because we have, like I had mentioned, we have a very diverse population, both geographically, culturally, economically, and the characteristics of those individuals within those different communities and how transmission occurs is very different. So understanding those transmission methods based on different communities, whether in some areas, if we have lots of multi-generational households, maybe the transmission method is through household contacts, and that's more prevalent in certain communities in certain areas, as opposed to, I don't know if I know Boulder was in the news recently for outbreaks within their the University of Colorado campus there, and so school and educational outbreaks is very, very different, and it's a very different scenario in terms of transmission. And so, and then also we have workplaces, and so several of our counties, our populations have the ability to work from home in certain areas, as opposed to other areas where they have to, they're required to be on the job site in order to do their job. So all of these things, in terms of understanding the geographic differences in that method of transmission, we're able to assess once we get it into a GIS. And if we didn't do that, essentially those nuances to the data would be sort of lost in aggregate if we are just looking at all the events that happen in one of our counties, or county by county, as opposed to very specific communities or clusters that we can identify within a GIS.
That's amazing. So by doing this, you've been able to better identify different types of transmission and different places of transmission. And it sounds like that's helping the health department to better message to communities and focus the types of interventions that you may want to propose to end the pandemic as quickly as possible across your communities. One of the things that I know is so important for contact tracing is time. It's a huge factor, right? Because if we're not efficient, then you're not going to actually be effective. So you've been able to identify, I hope, close contacts before they can infect others. Has GIS helped you to process your case and contact investigations a little bit more quickly? Has it been an efficiency for you?
Yes, for sure, especially within household contacts, because we've been able to quickly modify our system to investigate household contacts immediately during the case investigation of the case. And so those close contacts, we can do, there's no delay. And so right away, we're able to figure out their exposure, the duration of their exposure, how vulnerable they are, what community resources we need to connect them to, and let them know about different isolation measures. And so we can do that immediately through the system that we've been able to set up.
That's great.
And then we also can prioritize contacts during the case investigation as well, based on sort of the neighborhoods they live in, whether we're seeing spikes in those neighborhoods, whether and that again, the types of transmission that or exposures that we're seeing with those cases, we can then prioritize those contacts in terms of whether or not it's like, for instance, right now, if we have a huge backlog of contacts, we can just do the ones that we've flagged as a high priority or a high need.
Yeah, that's really a great point, because I know that there aren't enough contact tracers anywhere to handle the problem that we have at hand. So being able to prioritize even the work based on geography sounds like a useful addition. And earlier on, you were mentioning some community partners, and we were talking about data and collaboration. So how has GIS facilitated data sharing and collaboration during the pandemic? And do you think that this is going to permanently shift or change the way that your agency is working with your partner organizations?
Yes, I think that it's already created a permanent shift in the way that we work with our partner organizations. I think that anybody who's worked with public health data in the past realizes that there's never been a need to have data that's updated every 6 hours. When we look at traditional health data metrics, I mean, surveys were done every year. Vital records data is updated annually. And so the reporting was always very much sort of, maybe you do it once a year, and you'd have provisional data that you could report out on, but it was always provisional and filled with a bunch of caveats. And so this experience has been new in terms of, if it's a couple hours old, it's old data, and we've never had that issue. And so it's forced us to adapt very quickly in terms of how our data systems are set up in order to report out within a timely manner, and be able to report that data out to our partners specific to their jurisdictions or to the questions that they're asking. And so we provide location-specific data to our counties, our municipalities, again, our school districts, neighborhoods, even our wastewater districts, in terms of understanding the cases that are in those areas. And so being able, just configuring our infrastructure to be able to do that, and it definitely changes the way that we're putting out, because previously we would just do it in, say, a dashboard where we were the ones who analyzed the data, processed it, came up with the general messaging around it. But now we're providing, I don't want to say raw data, because we extract anything out that would be potentially identifiable, but we're trying to get them the highest resolution data possible to those jurisdictions, and providing it in, whether it's through a map layer, whether it's through a hosted table, or in some cases a Google spreadsheet. But depending on the capacity of the organization to be able to consume data, we've been adapting our delivery methods to accommodate where they're at in terms of their data infrastructure. I think that has permanent changes in the way that we move forward with how we provide data to our partners.
I think that's a collection of incredibly astute observations, Adam, because I've been seeing it too. And I think not only is this a very different time for the need for more current data, but I think it's also built this public expectation that health departments will now always be able to answer questions with current data. And having been in public health myself, I really was kind of internally laughing at the remark about, our vital records data and all of our data sets that are updated annually. I'm not sure if that's going to be good enough anymore, that expectations changed a bit. So we'll see how that goes, but there's hope, right? Because you're doing it now. What would you say, with all of these things considered, how has the perception of GIS and how it can help changed in your department since the pandemic began?
So for a lot of folks in our agency, I think this is the first time they've really had any exposure to GIS. And for the people who even knew what it was, I think GIS has always been that analytic tool that's been sort of siloed into its own sort of event where it's like, okay, we're going to do our work and then, oh, let's see if we can do something in GIS. But I think for a lot of individuals, we've been able to show that it's more of an entire process of collecting the data and then having that location data immediately feed into all of the analytics moving forward and data products moving forward, because it's just an integral part of the data itself, as opposed to being an afterthought. And so we see this in several of our other programs. I mean, whether it's, I want to say, we have, say, our farmers market program where they realized, oh, we can collect data about our participants, and there are going to be location-specific characteristics about our participants, and we have these methods of collecting the data, seeing the data, and us being able to consume it in real time as the events are occurring. And we can see, oh, we have this influx of people from this area, and they're younger over here, or they're so I think it's been illuminating for a lot of people in our department to be able to kind of conceptualize how data is captured in a broader sense.
Well, I have to say, Adam, you just warmed my heart. I love when I hear that people are thinking of GIS, beyond the occasional tool or making a map, that it is a workflow, and you really said that beautifully, so thank you. What do you think is next for GIS at Tri-County Health, both in terms of the pandemic and the continuing response there and beyond?
Just in terms of the pandemic, I mean, right now we're just trying to keep up with our current influx of cases. It's been a kind of staggering for us. But I think that moving forward, I mean, we're going to continue with our analytics. We've built this system that we've been doing our case investigation and contact tracing in, and continually adapting it and adjusting it based on obviously with COVID, it's the questions and the scenarios in which these events are happening are continually changing. Whether it's the schools were in the conversation a lot recently. Prior to that, it was the Labor Day gatherings, the 4th of July gatherings, the flattening the curve, all of that. And I think that coming up, we're talking about perceptions of vaccines, about holiday travel, just COVID fatigue, and all of that. And I think that there's geographic aspects to all of those in terms of understanding where people are at on all of those ideas, and then how we can use that information to then develop specific mitigation plans and strategies moving forward. But then beyond just the pandemic, again, the farmers market thing was I feel like a very basic kind of idea of adapting these tools that we've been a more complex tool that we've deployed within our agency, but to a very a simpler process. but we're also, we've been talking about expanding it out to the way that we just collect data in general around septic systems, around oil and gas operations, water testing, all of that, that has very, where geographic data is inherent in the information that we're collecting. So I think that we are going to, it's going to be much more prevalent in the work that we're doing.
Oh, I'm also glad to hear that. And, you know, you made me think the one thing, and this has been said a zillion times before, that we can all count on that is totally stable is the fact that there's always change. And so your discussion of having to be agile and being able to adapt really resonates, I'm sure, with everybody watching. So in some ways, maybe this is a little bit of a redundant question, but maybe you want to expand on the thought. What lessons learned during the pandemic do you think can be applied to whatever normal is going to look like moving forward?
Yeah, I think for us, it's going to be around that data sharing aspect, the temporal aspect of the data that we're sharing. It just, I think the expectation now is that data is delivered very rapidly. And again, there's all those ways in which the traditional public health data systems don't respond that quickly. So I think that it's going to change the way, the conversations we have with how we receive those data from our state vital records office or from other surveillance tools to maybe encourage different ways to do that in a more real-time manner. And so I think that it's just going to challenge us to think about the mechanisms by which those data are collected and if we can improve that. And then I think that for us, and this might not be entirely on the GIS end, but we really, one of the biggest lessons was just about workflow and understanding, really fleshing out a workflow, especially for a complex task. And that these tools are amazing, and it allows, I call myself a non-technical person, however, people here would probably call me a technical person. But our ability to provide these tools that facilitate a workflow, but the fact that that workflow really needs to be fleshed out, and it takes a lot of people to really kind of understand that, from the data aspect all the way to the people doing the work, to the people who consume the data, to the people who report the data out. It takes everybody involved to really to pull that together, and that's where I think when we did that, it just really illuminated for a lot of people the benefit of this, just the GIS system and the comprehensiveness of it.
Yeah, I think that I personally have, like you just said, seen a lot of teamwork and task forces that are really focused and diving into things more deeply, and that's been pretty inspiring, and maybe we'll also learn from that going forward. You know, I want to thank you, Adam. I think it's pretty clear to me and hopefully to everybody else that Tri-County Health was really out ahead of the crowd in their thinking and their modernization of the contact tracing process. You and your colleagues are true innovators. And you know, I think I've told you this, you also inspired a few of us at Esri to become certified contact tracers, myself included. And you showed us yet another application for the GIS platform. So I really want to thank you again for sharing this time with me and your thoughts. And thanks too to our viewing audience for watching.
Thanks for having me.